Hi, this is Dr. Chu. I'm here at CES 2010 at the Digital Health Summit. I'm here at the Tunstall booth with Michael, and what we're going to talk about is their digital gateway device. We've seen some other gateway devices today. Michael, tell us, how is yours different than the other ones we've seen?
Ours is different because it has this interactive user interface that can be totally customized from the back end, meaning that when the device dials in and connects to the back end server, it will load these interviews, and these interviews can be down to the individual patient.
How are the interviews conducted? Is it through the touch screen here?
So it's not really a touch screen, but it has a few buttons. It's designed for the 65 plus population, so they would not be able to operate an iPod or something like that. They are also typically very sick people that are being monitored for one of these chronic diseases like CHF or COPD.
But the idea is that your gateway device will prompt them with a series of questions before they step on the biometric device, whether it be a scale, a blood pressure cuff, a glucometer, a pulse oximeter. Is that the general idea?
Well, the session, you can actually have the measurements performed first, if that's what you want. Often we want the blood pressure monitoring to happen before we start any of the questions, because the patient would need to sit down and relax for 10 minutes before they start taking their measurements. So typically we start with the vital sign monitoring, and then we move on to the questions that relate to the disease. Things like, are you short of breath? You can ask questions like, do you feel that your legs are swollen? Stuff like that.
Now, Michael, tell us a little bit about your gateway device. How is the connectivity achieved? Is it achieved through Wi-Fi, through 3G, 4G? How does it connect to the server?
So to connect to the server, we have two models. One that connects to the cellular network, it's GSM GPRS. The other one here is PSTN connected to a normal phone line, typical modem dial-up communication, and you see the phone lines back here. So
an elderly patient would at least have to have a telephone, but they might not necessarily need to have broadband Wi-Fi.
That's true. Okay. That's true. This is designed also for self-install, really. So 80% of the population that we monitor is able to actually install this themselves. It's down to putting batteries into the medical devices and then plugging in the device. The GSM one is really easy because it has only one, the power adapter to plug in. It's got a SIM card slot right here, so it will automatically connect to the internet from wherever you are.
Now, a couple more questions, Michael. Your device asks questions. Can those questions be customized by a physician?
They can, and they are audio recorded questions, so they will actually play the recordings of these questions.
And is it a two-way communications platform in the sense that if the doctor wants the patient to come and see him, is there any way to tell the patient, oh, your blood sugar is really high, come in and see me?
Well, from a device point of view, that is possible. From our back end, that is not yet possible. But you would be able to. It's not real time. So what happens is everything that you do on the back end that would change the configuration of the device would be downloaded to the device the next time the device connects. There's never communication that is being initiated from the server to the device. It's always the device that dials up and connects.
Now, a couple more questions, Michael. How many people around the world are using your gateway device?
It's close to 100,000. I don't think we've reached that level yet, but it's about 100,000.
And are most of them in the United States or elsewhere?
They're in Europe mostly, so in Western Europe.
So your hope is to try to bring this device in the United States and get us to use this here?
We are here in the United States with a couple of thousand units out there. We have an OEM customer that has had these devices for 4 years now, and I believe they have 30 or 40,000 patients out there.
One or two more questions. Tell us about first of all, tell us, is your device FDA approved?
It is.
And it is FDA approved, and how many medical devices is it approved to work with?
So the total list is about 40. The categories are weight, blood pressure monitoring, it's glucose meters, it's peak flow meters, there's ECG, we have a thermometer, and there's pulse oximetry, and I think there's a PCNIR. Maybe not on the scale, though.
Okay, Michael, thank you so much. This has been really great. If a physician is interested in learning more about your products, how can they get more information?
They should actually contact our sales director, Anthony Tironi, over here. So I'll give you his card, and you can post it.
Do you have a website?
We do. It's tunstallhealthcare.com.
All right. Thank you so much.
Thank you.